I'm Sara Austin. I'm a neurologist here in Austin. I'm board certified in neurology and neuromuscular medicine. I'm talking to you about diagnosis and treatment of neuropathy for the Medical Advisory Committee for the Neuropathy Alliance of Texas. It's really important that you get a good diagnosis to know what your prognosis is and what to expect, and to make sure that everything that's treatable has been ruled out. If you think you have a neuropathy, the place to start is to see your doctor and let them see what they think. And most of the time they'll refer you to a neurologist. The neurologists who mostly deal with neuropathy would be the neuromuscular neurologist. The neuromuscular neurologists know the most about nerve and muscles. Your neurologist will do a history and an exam, and the history ought to include how long it's been there, how long your symptoms have been there, what they feel like, if you have a family history, what medicines you've taken, particularly if you've had cancer, if you've ever had chemotherapy, that kind of thing. Anyway, and then on their exam, they'll check your strength. They'll do a good sensory exam. They'll check your reflexes. They'll watch you walk, check your balance, that kind of stuff. Those are all things that they should do that would be a standard part of the exam. This slide has a list of some of the blood tests that would be considered when you show up with a neuropathy. I would doubt that your neurologist would do all of these blood tests, but based on your symptoms and the time frame of the presentation of your neuropathy, these are some of the blood tests that they might consider doing. That GTT is a glucose tolerance test. That actually is done fairly commonly, and so it's where you drink the sugar water and they check your blood over a couple of hours to see if you've had the usual rise and fall in your blood sugar, to see if you have glucose intolerance. These are additional tests that might be considered as well. Again, your neurologist will tailor these tests to your type of neuropathy. Your neurologist might recommend that you do a nerve conduction study and an EMG. I do those frequently for people with neuropathy. It tells me a couple of things. One, it tells me if somebody has a neuropathy. It'll tell me how bad it is. It'll tell me what type it is, so it'll tell me if it's axonal or demyelinating. I think it's a very useful test. The skin biopsy, like we said before, if you have a small fiber neuropathy, often the nerve conduction study will be normal. And in that case, if I really suspect that somebody has a small fiber neuropathy, or if I have any question about the diagnosis of a small fiber sensory neuropathy, I'll consider doing a skin biopsy to confirm the diagnosis. So that's something that we'll do fairly often. The spinal tap or lumbar puncture, I really only do that if I'm looking for a demyelinating neuropathy, like a chronic inflammatory demyelinating polyneuropathy. I'll suggest that we do a lumbar puncture, looking for elevated CSF protein. When you talk about treating neuropathy, there's really two different things you're looking at. One is to try to treat the neuropathy, which is to reverse it. And the second one is to treat the symptoms. And sometimes you can't actually treat the neuropathy, so you're left with just treating the symptoms. And so you kind of want to make it clear with your doctor which one you're aiming for. If it's a hypothyroid neuropathy, so like your thyroid is too low or your B12 level's too low, then you're actually treating the neuropathy by treating your thyroid or replacing your B12. If it's an idiopathic neuropathy, you don't know why you have it, then there's really not a treatment that's going to reverse it because we don't know why you have it. So then you're just focused on treating the symptoms. So there's really two different pathways that you're looking for, and you want to try to do both if you can. If you have a known cause of your neuropathy, like for example, it's an infection like leprosy or syphilis, then there's an antibiotic that can treat that, and you should get better. If it's a toxin that's causing your neuropathy, then you want to take that toxin away. The most common one would be alcohol. B12 deficiency is actually a very common cause of neuropathy, and it's one of the things that if anybody has any numbness at all, I almost always check for B12 deficiency. It's more common than you think, and it's worth checking for. It's an easy blood test. When people get diagnosed with a diabetic neuropathy and their feet are really hurting, we can always treat that with medicines. Sometimes that helps. Sometimes it doesn't. Most of the time it helps, not always. It's always a good time to talk about other things that you can do besides just medicines to make your feet feel better. So, of course, losing weight is helpful. Getting your blood sugars under control is really helpful. You know, not smoking and making sure that your diet is healthy and you try to eat less fat and all that kind of stuff is always helpful. There's a study that they're doing right now trying to get people to walk more, which doesn't make intuitive sense that you would walk more on feet that hurt. But there's some thought that that really helps. Staying active really helps your feet. So if you have an immune-related neuropathy, you have a neuropathy that is caused by dysfunction of your immune system, there are a lot of treatments for that. You can use steroids, which suppress the immune system. You can use IVIG, which modulates the immune system. And then there's a whole host of other medications that you can use that are probably used less commonly, but we do use those as well. Those medicines are all tricky to use. They all carry side effects. You need to have a doctor who knows how to use them and has some experience in using them. But they work. The hereditary neuropathies don't have any treatment yet. The only treatment we have is supportive care. Sometimes bracing helps. Practicing your balance helps. Treatment for neuropathy pain is important because neuropathies can really hurt. And so what I usually tell people is I don't have the perfect medicine. If I did, I would use it every time. So I have some medicines that probably work my best medicines work about 60% of the time. And some medicines will work for some people and some medicines will work for others. Probably my best medicines are gabapentin or Lyrica. They are cousins of each other. They're sort of related to each other. Both of them have very few side effects for most people, and they're fairly safe, and they seem to work fairly well. I have good luck with nortriptyline, which is an old antidepressant medicine, and I usually tell my patients I'm not giving it to them because I think they're secretly depressed. I'm giving it to them because those medicines work on the same neurochemicals that those nerves are using to transmit up to their brain, those pain pathways, and they seem to help. Topamax helps some. Cymbalta seems to help some. Some people like the topical agents, the lidocaine patches and the creams. Some people just like having their feet rubbed with cream. There's a big long list of medicines to try. I find the best method is to pick a medicine, push it to the limit, either you get side effects or it helps, and then go to the next one. There are some neurologists who are trying different ways to treat the pain from neuropathy. I don't know if that works. I have some people who have such bad neuropathies and they have such bad pain. I think if you're willing to try these things and I think they're fairly safe, then I think it's a good idea to go ahead and try them. If I had the perfect answer for you, I would tell you what that was, and I don't think there's a perfect answer out there right now. So some people will do nerve blocks down around the foot and ankle, and some people get relief from that. The spinal cord stimulators are sometimes put in by the pain management doctors. I do not know what the statistics are in terms of how well they work and how long they last. I do know that if you have a spinal cord stimulator placed, you can't get MRIs anymore. And as a neurologist who uses MRIs for other things all the time, that is somewhat of a reason not to put in a spinal cord stimulator, but it's just one of those things you'd want to weigh when you're thinking about a spinal cord stimulator. If you can try physical therapy, I would probably use physical therapy personally for more balance and strength and things like that. I don't think they can do too much for pain control. People with really, really numb feet, especially people who are prone to ulcers, because if you have incredibly numb feet and you can't feel pain, there's a good chance you can get those non-healing ulcers on your feet. And those people really need a very good podiatrist. I have a lot of people who use ankle-foot orthosis, and a good brace maker can do that for you. It's much harder if you have if the weakness extends up into your thighs and you need a knee brace. Knee braces are harder to deal with. They tend to be heavy, and a lot of people don't like those, but a lot of people like the ankle braces. I do tell people a lot of times to use a cane. People think that they're wussing out by using a cane, but actually it actually makes them much more stable. You can't feel the floor like you're supposed to, and if you fall down and break a hip, there's no good that comes from that. If you have trouble feeling the floor and your balance is not so great, the cane gives you a third point of feeling on the floor, and it's very, very helpful. And speaking of that, falling in the middle of the night is fairly common. If you can't feel the floor, you're using your eyes to see the floor. And if you're walking around in the middle of the night and you can't see the floor, then you're in trouble. So you should always have a night light in your bathroom. You should get rid of all those little throw rugs on your floor. If you have a little dog, you need to make sure that he's put up so that you don't trip over him. Those things are really important because I'm not kidding, breaking your hip is like the worst thing that can happen. And it only takes one fall to have that happen. The whole gluten sensitivity and all that kind of stuff is not very well proven or supported in the conservative medical literature. So you can do what you think is right. I don't think it hurts you to be gluten-free. I don't know if it helps, but if you think it helps, it works for me. That's okay. You can supplement your vitamins. I'm not sure that it helps. I don't think it hurts, as long as you don't take too much B6. So B6 is pyridoxine. That's the one that can cause a neuropathy if you get too much of it. There's no evidence that any of the other ones cause any trouble if you get too much of it. I personally think that alpha lipoic acid might help, especially if you have diabetes. I think the dose is 600 milligrams twice a day, and you can get that at the health food store. I've never seen evidence that Metanex actually makes a big difference. It is actually prescription and it's fairly expensive. What I would do is probably just take some extra B-complex vitamins and folate. Exercise definitely helps. Weight loss helps. Working on being healthy and decreasing stress helps. All of those things are a great way to make yourself more healthy in general and help your neuropathy. I tell people with neuropathy to practice their balance. And practicing your balance won't keep you from starting to fall. You're still going to trip. You're still going to hit that curb wrong sometimes. But when you do those things, you'll be able to catch yourself better. And you'll be less likely to actually hit the floor. I believe in acupuncture. I think if your feet are really, really painful and they're really bothering you, I would try acupuncture. I think it's a viable alternative. Massage, I can tell you insurance is never going to pay for it. We all wish that they would, but they're not going to. But if you can afford it and you would like to try it, I think that's a nice alternative too. I do have great hope for Tai Chi. The Neuropathy Alliance has put together some classes, and I've had patients who have had good benefit from this. And so I would definitely try the Tai Chi if you can do it. It works on your balance, it works on your muscle strength. I just think it's a great alternative and you should try it if you can. We listed some alternative therapies on these slides, and they really are alternative therapies. They are emerging. Nothing for sure is known about them. I think you'll have to wait and see what kind of gets proven. We'll do case studies. So the first one would be a 45-year-old man that came to see me because he had noticed some numbness in his hands for about 3 months. Pretty constant. It wasn't coming and going. It was always there. And for the past 1 month, he had noticed a little bit of numbness in his feet as well. Just a little bit of tingling. It was sort of constant. It wasn't painful. No weakness, no imbalance, nothing else, no family history. And on exam, he really had a normal exam. So poking him with a pen and vibration sensation and balance and all that, reflexes were all normal. I did a really brief nerve conduction study and everything looked normal except his sensory responses were a little bit low. And really, until his sensory responses were low on nerve conduction studies, I really didn't think we'd find anything at all. And they were low, and so I sent him for a B12 level, sent him for a hemoglobin A1C and a thyroid level. Everything came back normal except that his B12 level was low. It was about 200. And for some reason he was B12 deficient. I don't know why. He eats normal food, a normal diet. He wasn't vegan, you know. And so for about 3 weeks he took extra B12 supplements, just oral supplements, just bought some B12 vitamins at Walgreens and ate a bunch of them. And we rechecked his B12 level. about 3 weeks later, and it had come back up to normal, so he clearly absorbed B12 in his stomach, which was good. And he kept taking that. And his arms and his fingers or his hands were numb for probably another 6 months, and then it finally went away. I saw a guy probably about a year ago that came to see me because his feet were numb and burning. And they had been doing that for probably a couple of years. And it was really 24/7. I mean, he said they were pretty painful. So on a pain scale, probably averaging 4 out of 10 most of the time during the day. Nothing else, no imbalance, no weakness, no family history. On exam, he was a little overweight. Everything else was fine. And his strength exam was normal. His sensory exam, he had a little bit of loss of vibration sensation in his ankles, more than you would think he have. And when you poked on him with a pin, down below his ankles, he had lost his pinprick sensation. He could still feel that you were poking him, or that you were touching him with something, but he couldn't feel the sharp anymore. His hand was normal, and his reflexes were normal, except his ankle jerks were gone. And anyway, nerve conduction studies showed a little bit of neuropathy, so a little bit of low amplitude motor and sensory responses in his feet. And hands looked normal. And so I sent him for labs, sent him for a B12 level, which was normal. Sent him for thyroid studies, that was also normal. Sent him for a glucose tolerance test, and he flunked that pretty badly. I mean, his blood sugar at rest was a little bit higher than it was supposed to be, and then when he drank the sugar water, went way, way up, and never really came down the way it was supposed to. And the rest of his, chemistry panels and all that kind of stuff were normal, and his CBC was normal. So he really has undiagnosed diabetes. I mean, he's got probably considered a little bit of pre-diabetes, but he really has diabetes. And so we sent him to his regular doctor, who sent him to the diabetic training person who put him on a diabetic diet. And I think his regular doctor would probably follow him for 6 months and make sure that his hemoglobin A1C went back down. The big thing this guy could really do is lose 40 pounds, because if he lost 40 pounds, his diabetes would go away. And I imagine his neuropathy would get much better. But he was just one of those unfortunate people that the way his diabetes showed up was with a neuropathy. I saw a lady a while back who was in her mid-30s, and she came in a wheelchair. And she was referred by her regular doctor, who hadn't seen her for very long, and it was because her hands and her feet were numb. Started looking at her, and she had no family history and didn't really have anything wrong with her head and neck. She could swallow fine, her speech was fine, she was eating and everything, her weight was fine, she wasn't losing any weight. And on exam, she had normal strength, so she could pull and push against me without any problems. But she really had a lot of trouble with her sensation, so she really had no idea where her hands were in space. So when she closed her eyes and tried to, I usually have them touch my finger a couple of times, and then I'll have them close their eye and go back and touch my finger, and people can do that without any problem with their eyes closed. Once they know where my finger is, they can always find it again. She would be out here. I mean, she had no idea where it was, so she didn't know where her joints were in space at all. And same with her feet, and she couldn't feel any vibration anywhere. So she had proprioception loss, is what you call it, that position sense, and she had loss of vibration sensation. She could still feel a pin pretty well. She had no reflexes anywhere. So if you had her walk, she really needed 2 people on both sides of her to help her walk. Her balance was so impaired, she couldn't walk by herself, which was the reason for the wheelchair. Anyway, and on nerve conduction studies, she had pretty normal motor responses, but she had no sensory responses at all. So her big sensory nerves, those big large fiber sensory nerves, had all died out for some reason. They were just all gone. So we talked about that list of all those stuff that you test. We tested all of those things, like everything we could possibly think of. They all come back normal. Everything was normal. That's an idiopathic neuropathy, an idiopathic large fiber sensory ataxic neuropathy is what you call it. I have no idea what happened to her large fiber nerves. They're not coming back, I don't think. She's in a wheelchair. There is no treatment that I know of. I had a 70-year-old dentist who came to see me complaining of a little bit of numbness in his feet. It didn't hurt, it wasn't painful. And it hadn't caused him a lot of trouble. He had just started noticing it. for probably a couple of years, and then when you really started questioning, probably about 5 years. So it had been pretty long. Hadn't noticed any problems in his hands, was still a dentist and hadn't noticed any problems there. And it takes a lot of coordination to be a dentist. You know, it's really fine finger control. And, you know, on history, he might have had somebody, one of his parents might have had some trouble with their feet as well, but he wasn't really clear about that, you know. And on exam, everything else was fine. He had normal looking hands and normal strength in his hands. And his feet, he had really high arches and hammer toes. So his arches were real high and his toes were pulled up like that. And he had a lot of atrophy of the intrinsic foot muscles, so his feet looked really bony. He had never noticed that. They didn't bother him, you know, and he stood on his feet all day, but I imagine he wore tennis shoes because he was a dentist. And he had loss of pinprick sensation probably below his mid-shin, and then his vibration sensation in his ankles was absent, wasn't there at all. And his strength was normal, so he could pull his toes up and down and all that kind of stuff, and it was fine. And his tandem walk, so he could walk in a straight line without any trouble at all, was good. And then he had reflexes in his arms and a little at his knees, none at his ankles. And on nerve conduction study, he had just a profound neuropathy. I mean, you couldn't get any responses at all below his knees. And it was kind of surprising because to him, he had very few symptoms, just a little bit of numbness in his feet. But to me, he had a pretty bad neuropathy by nerve conduction study and pretty bad neuropathy by, you know, by my exam. And it turned out that he had a hereditary neuropathy, which is a pretty classic history for hereditary neuropathy. So it usually comes on very, very slowly. It happens so slowly that he doesn't notice it. So what I usually tell people is if I put you on a normal pair of legs, you go, oh, wow. You know, I had no idea that people could feel their feet like they can. So he had adjusted to it for all these years. He had kind of ignored the fact that his parent, one of his parents, probably had the same thing. We didn't do any genetic testing. There is, for the axonal hereditary neuropathies, you can do some genetic testing, but they found some of the genes that coordinate with this, but not most of them. And so it's really, I don't actually recommend that we do that. For the CMT type 1, the demyelinating neuropathies, you can do some of the genetic testing and it's pretty accurate. But for the axonal type, I usually don't recommend that we do that. But mostly we did all the other tests for neuropathies. And for the most common cause of neuropathies, it was all negative. But he had such a classic history for a genetic neuropathy that I wouldn't do just a lot of other blood tests. I mean, he just had a very classic hereditary neuropathy history and exam. When you have a neuropathy, it's important for you to keep track of your symptoms. So your doctor would expect that you would let them know if you feel like you're getting worse. For example, if your numbness was at your ankles and now it's at your knees, your doctor would need to know that. Or if you feel like your weakness is getting worse, they would particularly want to know that. So your doctor expects that if you feel like you're worsening, that you give them a call and let them know. Or if your pain is getting unmanageable, that you give them a call and let them know. The Neuropathy Alliance has a self-assessment that they use that you might use that might help you do that. I hope you found this video on diagnosis and treatment helpful. If you have any questions, please feel free to contact the Neuropathy Alliance.